For those of you who are joining us for the first time or are new to the Tech Council, the San Francisco Tech Council is a multi-sector initiative, and we build government, business, nonprofit, and consumer collaboration to advance digital inclusion for seniors and adults with disabilities in San Francisco so all can participate in the city's connected community. We have Marcie Roth, who's with the World Institute on Disability, and she serves as its executive director. And she brings a lifelong commitment to advancing the rights of people with disabilities and expanding disability leadership locally, nationally, and globally. And more importantly, also the digital tools for optimizing community living and accessibility solutions are at the center and forefront of WID's work.
I'm going to make the assumption that most of you are familiar with the World Institute on Disability, but I'm going to take a moment and just tell you a couple of things about WID. We were originally founded in 1983 by Ed Roberts, Judy Heumann, and Joan Leong. And WID is one of the first organizations in the world focusing on the rights of people with disabilities, founded by and continually led by people with disabilities. So I've been with WID for not quite a year now, and when I was brought on board, I was asked to do some disrupting. WID has been through, many very important phases in our work, and it became very clear that the organization had an opportunity to move forward in some new ways to expand our reach and our impact. And so, as a global organization, with an obligation to focus on the needs of what is described as 1 billion people with disabilities globally. We know very well that it is a far higher number than that. We took a pretty deep dive into what our priorities are, and we've identified 4 key domains in which we're doing our work. First and foremost, from our roots, we have always been all about bringing research and policy into action and operationalizing inclusion. So we do that through a variety of work approaches. We have a long-standing program with digital tools to optimize community living and employment as well. We focus on accessibility solutions and newly a focus on excellence in disability inclusive emergency preparedness, disaster risk reduction, and climate resilience. And heaven knows, we have been extremely busy. I'm going to spend a few minutes talking about our accessibility work, which is really at the heart of everything we do. And we are especially committed to universal design and wanting to be clear that universal design is where you start. Universal design is not where you end. Universal design levels the playing field so that as many people as possible can equally access and use, whatever they need in order to facilitate their intention in an activity. But beyond that, not everybody is going to be able to equally access the world around them with a universally designed community. And so we also need to be sure that additional accommodations, additional modifications, and where necessary, reasonable accommodations are provided to facilitate equal access to physical built environment spaces, in equally accessing effective communication, and in programs and services as, of course, the law requires. So we offer a variety of services to achieve that. And I'm going to focus on a couple in particular, which has to do with our accessibility testing and with event consultation, two key areas in which we work. But then I'm also wanting to focus on the digital tools that we have developed for independent living, employment, emergency planning, voting, economic empowerment, and the work that we're doing internationally. I don't have the time today to do much of a deep dive in each of these areas. And so we really wanted to take the time today to begin to introduce some of the work that we're doing that, quite honestly, is unfortunately extremely timely. And that is the work that we're doing in emergency preparedness, disaster risk reduction, and climate resilience. And, whether it's the current wildfires in your area in the Bay Area or across the state, whether it's everyone globally trying to navigate the pandemic, or the hurricanes that are currently brewing on both the Eastern Atlantic and the Pacific, or whether it's the earthquakes. There were earthquakes, several earthquakes over the last couple of weeks, one in North Carolina. I know you all have had some, always, but a couple that have been disruptive. And the reality is that people with disabilities are disproportionately impacted in emergencies and disasters. And people who are poor, people who are Black and brown and indigenous people, people who experience multiple marginalization in their daily lives as people with disabilities, are much more disproportionately impacted in disasters than people with disabilities who are not experiencing that multiple marginalization. And then certainly all people with disabilities experience a disproportionate impact from disasters. So, we've been looking at this for a very long time. I often refer to it as admiring the problem. And we have admired these problems for a very long time. And now we find ourselves in a really deadly situation. So in May, we brought together colleagues, allies, friends from across the globe to hear from them about their COVID-19 experiences. We heard from folks about their other disaster experiences. We had folks joining us from 22 countries. We asked some key questions, and I'll do a dive into some of that in a couple of minutes. But we got some very important information from people with disabilities and our allies. And then about a month later, we brought folks together again. This time we had 25 countries at the table. And as well, we had in the second town hall meeting, we had folks from 6 of the 7 continents, not expecting to have a lot of participation moving forward from Antarctica, but we do look forward to having folks from the other 6 continents actively involved. So we are, especially pleased to have folks from 47 countries who have been involved in these discussions about what happens for people with disabilities before, during, and after disasters, and in terms of the accessibility requirements and the design and implementation of preparedness and the opportunities when building back after disasters. And, this has really informed a lot of our thinking as we're moving forward. One of the things that became very clear to us was that local disability-led organizations in the US, we often just refer to them as disability-led organizations, of people with disabilities, leadership, board leadership, majority people with disabilities. In other parts of the globe, they're referred to as disabled persons organizations, DPOs, and newly in some other parts of the world, OPDs, organizations of persons with disabilities. Bottom line, they all mean the same thing. People with disabilities in leadership roles, contributing to their local community, and in all ways participating as full and equal members of the community. So we asked folks a number of questions about whether they felt in the pandemic that they, as disability-led organizations, had the resources they need to serve their communities. And they told us that in almost every case, they did not have the resources, or that they only sometimes had the resources, which of course in an emergency, in a disaster, sometimes is not adequate, right? And we then asked if they believed that disability-led organizations are left out of traditional disaster relief funding. And in fact, 100% felt as though they are always, definitely, or sometimes left out of funding from foundations, corporations, and government. Those funds typically go to much larger organizations that are not led by people with disabilities, organizations that are typically service providers, and organizations that are not committed to the accessibility needs of people with disabilities in disasters. They, 96% felt as though it would be useful to participate in disability and disaster relief funding discussions. And 93% wanted to be part of an alliance of disability-led organizations and funders and allies who could collectively accelerate resources in disasters. So we also asked them about what their needs were in COVID particularly, but also in other disasters. No surprise, people talked about needing funding and monetary assistance, but they also talked about needing disability equipment and services, training, for preparedness, being able to build capacity for being ready for disasters, eliminating bias, and being knowledgeable about rights during disasters. Many needed personal protective equipment, access to personal care attendant services has been pretty complicated in the pandemic. It's always pretty complicated in disasters in most places. People talked about needing technical assistance for remote work and, basic communication and equipment for remote work. Many organizations are not designed in ways that people can work from home. And so many people didn't even have a computer. They didn't have an internet connection. So it was very helpful to hear this information. And this then led us to, on July 7th, launch the Global Alliance for Disaster Resource Acceleration, also known as GADRA. And GADRA is very simply an alliance of disability-led organizations, funders, and our allies to bring resources to local communities in disasters without having what I call the humanitarian industrial complex all skimming from the top, so that those local organizations don't get the resources that they need in order to optimize the outcomes in their local communities. So, very simply, we are building this alliance. We are growing our Global Emergency Operations Center, and we are continuing to grow the reach of our Disaster Assistance Connections Hub. Our goal is bringing people together to disrupt the exclusion of disability organizations and people with disabilities from disaster relief, and to accelerate their inclusion to optimize the accessibility of these emergency and disaster resources for the whole community. So we had a great launch, brought together folks from across the globe. We have a founders circle of, we call them our founders circle, and we are excited to be adding to the founders circle organizations that will be participating in growing this very hyper local and global activity. One of our colleagues from Bristol Myers Squibb coined a term for us recently called glocal. So working globally, but having real impact at the local level and holding up those local disability-led organizations to support their communities. We will be matching organizations with disaster needs, along with funders who want real impact at the local level. And we will be doing this collaboratively. I'm going through the slides quickly, but happy to share them so that you can get more information here. We've begun to get quite a bit of attention. I am especially proud of our working relationships with folks who are on the call today. And I want to thank you very much. And I'm going to turn it back to you all, and look forward to more conversation. Happy to answer questions.